Imagine living with hypertension and not knowing that certain behaviors can worsen your condition. In this video, we'll reveal the 12 mistakes that someone with high blood pressure should never make. These tips are essential for controlling blood pressure and avoiding serious complications. Subscribe to the channel and turn on notifications so you don't miss any important content. Let's get started. Before diving into the mistakes that someone with hypertension should never make, let's first understand a bit more about this condition. Hypertension, also known as high blood pressure, is a chronic condition where the pressure in the arteries is consistently elevated. This forces the heart to work harder to pump blood through the body, which can lead to a range of health complications, including heart disease, strokes, and kidney failure. Now that we have a basic understanding of hypertension, let's discuss the 12 mistakes that someone with high blood pressure should never make. These actions can worsen the condition and increase the risk of serious health problems. Pay attention and take note to avoid these slip-ups in your daily life. Let's begin. Mistake 1. Poor sleep. Poor sleep is a critical mistake for those with hypertension. Inadequate sleep can significantly increase blood pressure because the body doesn't get enough rest and recovery time. During sleep, blood pressure naturally decreases, allowing the heart and blood vessels to recover. When sleep is interrupted or insufficient, this process is disrupted, resulting in elevated blood pressure levels throughout the day. Moreover, sleep deprivation is associated with increased levels of stress and inflammation, both factors that contribute to hypertension. To control blood pressure, it's crucial to establish a consistent sleep routine, ensuring 7 to 9 hours of quality rest each night. Mistake 2. Not drinking enough water. Not drinking enough water is a mistake that can worsen hypertension. Dehydration causes blood volume to decrease, making the heart work harder to pump blood through the body, which can increase blood pressure. When the body is dehydrated, blood vessels constrict, increasing resistance to blood flow and consequently raising blood pressure. Additionally, dehydration can negatively affect the kidneys, which play a vital role in regulating blood pressure. Lack of water prevents the kidneys from eliminating excess sodium from the body, contributing to increased blood pressure. Staying well hydrated is crucial to help dilute the blood and facilitate the work of the heart and blood vessels. Therefore, it's essential to drink an adequate amount of water daily to maintain blood pressure under control and promote overall health. Mistake 3. Unhealthy diet. An unhealthy diet is one of the biggest mistakes for those with hypertension. Consuming foods high in sodium, saturated fats, and sugars significantly increases blood pressure. Processed foods, fast food, and sodas are the main culprits, contributing to weight gain and increased bad cholesterol, LDL. These factors strain the heart and blood vessels, raising the risk of cardiovascular complications. To keep blood pressure under control, it's essential to adopt a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Reducing salt intake and avoiding processed foods are crucial steps to improve health and prevent spikes in blood pressure. Mistake 4. Chronic stress. Chronic stress is a serious mistake for those with high blood pressure. When we live under constant tension, our body releases hormones like cortisol and adrenaline, raising blood pressure and putting extra strain on the heart. This prolonged state of stress also contributes to inflammation of the arteries, increasing the risk of plaque formation that can obstruct blood flow. Moreover, stressed individuals are more likely to adopt harmful habits such as excessive alcohol consumption, poor diet, and lack of physical exercise, further exacerbating cardiovascular health problems. To manage chronic stress, relaxation techniques such as meditation, yoga, and regular exercise are recommended, along with a balanced approach to personal and professional life. Managing stress is not only essential for mental health, but also for maintaining blood pressure under control and preventing hypertension-related complications. Mistake 5. Not monitoring blood pressure regularly. Failing to regularly monitor blood pressure is a common mistake among people with hypertension. Lack of monitoring can make it difficult to control the condition and identify problems early on. Regularly measuring blood pressure at home with an appropriate device helps understand how treatment is working and if adjustments are needed. This also allows detection of any sudden increase in blood pressure that may indicate complications. It's recommended that people with hypertension regularly record their values and discuss any changes with their doctor to ensure proper control of the condition and prevent serious complications. Mistake 6. Consuming too much salt. Avoiding excessive salt intake is crucial for those with hypertension. Salt contains sodium, which retains water and increases blood volume, putting more pressure on artery walls. This can lead to increased blood pressure and higher risk of cardiovascular diseases. People with high blood pressure should limit daily salt intake to less than 2.3 grams, or about 1 teaspoon per day, as per medical recommendations. Reducing consumption of processed foods, fast food, and snacks can help control salt intake. Opting for natural seasonings such as fresh herbs and spices can add flavor to food without adding extra salt, promoting a healthier diet beneficial for cardiovascular health. Mistake 7. Excessive alcohol consumption. Excessive alcohol consumption can raise blood pressure and contribute to the development of hypertension. Alcohol in high quantities can damage the heart, kidneys, and liver, vital organs for blood pressure control and overall body health. Additionally, alcohol is associated with weight gain, another risk factor for hypertension. For those already with high blood pressure, it's crucial to limit alcohol intake according to medical guidelines to protect cardiovascular health. Mistake 8. Lack of physical activity. Lack of physical activity is a common mistake among people with hypertension. Inactivity directly contributes to increased blood pressure because the body doesn't receive the necessary stimulus to strengthen the heart and improve blood circulation. The absence of regular exercise can also lead to weight gain, further aggravating hypertension. Incorporating moderate physical activities such as walking, swimming, or yoga can significantly reduce blood pressure and improve cardiovascular health. It's recommended to engage in at least 150 minutes of physical activity per week, according to medical guidelines, to help control hypertension and prevent associated complications. Mistake 9. Smoking. Smoking is extremely detrimental to cardiovascular health and can significantly increase blood pressure. Cigarette chemicals damage blood vessel walls, making them narrower and stiffer, which raises blood pressure. Moreover, smoking increases the risk of serious cardiovascular diseases such as heart attack and stroke. Mistake 10. Ignoring family history. Ignoring family history of hypertension can be a serious mistake. If there are cases of high blood pressure in the family, your risk of developing the condition is higher. Knowing and monitoring your family history can help adopt more effective preventive measures, such as adjustments in diet, lifestyle, and regular monitoring of blood pressure. People with a family history of hypertension should be especially vigilant for signs of high blood pressure and seek regular medical advice. This awareness can aid in early detection and proper management of the condition, reducing the risk of serious complications such as heart attacks and strokes. Mistake 11. Self-medication. Self-medication is a significant mistake for people with hypertension. Taking medications without medical guidance can lead to serious complications, such as harmful drug interactions or side effects that can increase blood pressure. Some pain relievers, for example, can negatively affect antihypertensive medications, compromising blood pressure control. It's essential to always consult a healthcare professional before starting any treatment or taking new medications to avoid health risks. Regular medical follow-up ensures that treatment is adjusted as necessary, ensuring adequate control of hypertension and preventing serious cardiovascular complications. Mistake 12. Disregarding family history. Disregarding family history of hypertension is a serious mistake. People with close relatives who have or had hypertension are at increased risk of developing the condition. Ignoring this risk factor can result in delays in early detection of hypertension and implementation of preventive measures. It's essential to be aware of family history and share this information with healthcare professionals during medical consultations. This allows closer monitoring of blood pressure and early adoption of lifestyle changes, such as healthy diet and regular physical activity. Now that you know the 12 mistakes that someone with hypertension should never make, it's time to take action. Small changes in your lifestyle can make a big difference in your health. Share this video with your friends and family so everyone can be aware of these risks. Taking care of your health is taking care of your life. Until next time,